Hi, this is my case presentation, and I'll be talking about Frozen, specifically Elsa. And of course, this is by me, Austin Acosta. Please pardon my voice. I've been coming down with something, and my voice isn't too good. So, character description. Elsa is the crown princess of Arendelle who has magical ice powers. After accidentally injuring her sister as a child, she becomes fearful, isolated, and emotionally overwhelmed. The setting is a grand kingdom that is surrounded by deep forests. In this culture, there are many expectations when it comes to royalty, whether that be the way they compose themselves or how they are dressed. Elsa must remain calm and controlled, however, this culture increases her fear of showing emotion and worsens her anxiety. My diagnosis: generalized anxiety disorder. What is GAD? According to the DSM-5, GAD involves excessive anxiety and worry occurring more days than not for at least 6 months about multiple events, along with symptoms such as restlessness, muscle tension, difficulty concentrating, irritability, or sleep disturbance. Stigma. In many cultures, anxiety is seen as weakness or being too emotional. Leaders are expected to stay calm and composed, making Elsa fear judgment and hide her symptoms. Studies show that anxiety disorders are diagnosed differently across cultures because some societies emphasize emotional control or see anxiety as physical rather than psychological. And this is where I got it from my empirical cultural article. It's by Hinton and Lewis. Cultural differences in anxiety and expression. Evidence. Here are the symptoms displayed. Elsa experiences excessive worry. Movie example. During her coronation scene, Elsa repeatedly rehearses calm breathing, she shakes visibly and panics when Anna pulls off her glove, demonstrating uncontrollable worry and physical anxiety symptoms. Here's my DSM-5 citation. DSM-5 criteria for GAD includes difficulty controlling worry and accompanying physical symptoms such as tension or restlessness. Here is my empirical symptom article. Worry is the core feature of GAD and leads to avoidance and physiological tension. Sleep disturbance. It's also one of the DSM-5 symptoms of GAD. However, the film does not show chronic insomnia or nightmares. But we also don't see Elsa sleeping, so who knows, really? Treatment plan. My recommended treatment plan: cognitive behavioral therapy with exposure. CBT is highly effective for GAD. Why is it appropriate? It helps reduce worry cycles. It teaches Elsa to challenge catastrophic thoughts, and she gains exposure techniques, which help her gradually face feared situations. Barriers to treatment. Cultural pressure for emotional control. She does live in a society where she's under a lot of stress, being royalty. Lack of access. Maybe they don't have a, a treatment plan like this where she's from. I mean, she is in a kingdom, basically. She is in a kingdom. Fear of stigma or isolation. And here's my empirical treatment article. CBT is one of the most effective evidence-based treatments for anxiety disorders. As you can see, I put all these little characters on the side. I thought they were pretty cute, so hopefully you like them too. Here's broader perspectives. Frozen shows anxiety realistic using physical symptoms without making mental illnesses look bad. However, elements of magic turn her anxiety into a dramatic plot device, which is symbolic but not literal. Movies shape public understanding by normalizing anxiety and showing its emotional impact. Elsa's story increases empathy, but may also simplify into a power you cannot control, rather than a clinical disorder. Here are my references.